Hello everyone, today we are going to talk about thread lift. Skin changes is a natural component of aging. Over time, your skin loses strength and elasticity. As a result, the skin sags and wrinkles. Your cartilage deteriorates as well, and it no longer supports the skin around it as effectively. As the skin and cartilage in your face alter, you may notice drooping and looser skin. Facelift surgery was one of the sole techniques to address issues caused by facial skin laxity, such as jowls and sagging cheeks. A thread lift is a technique that makes your face appear younger. It is a minimally invasive technique in which a doctor inserts fibers beneath your skin to draw it back. They are less costly than plastic surgery and take far less time to recuperate from. In this video, we will talk about everything related to thread lift, the reason for resorting to it, the expected result after the procedure. Our role today is to answer most of your questions regarding thread lift. Today we have Dr. Park, who is a leading doctor at BIO Plastic Surgery. He is going to discuss with us everything about thread lift from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Dr. Park, what is thread lifting?
Nowadays, thread lifting is very popular. Long ago, only those who are older went for lifting. But with the advent of thread lifting, even younger people are interested in it. So what is thread lifting? If we look at the Roman shades, they are all intertwined with threads. So when we pull the threads, the curtain blinds shades go up, correct? So thread lifting is similar in the sense that we are lifting our skin sagging through lifting with threads. If we look at this picture, we can see how much facial sagging can be lifted from a variety of entry points. This is thread lifting. Lifting with threads without opening the skin. That is what we call thread lifting.
So how is the difference between other surgical lifting?
Surgical lifting requires opening the skin. There are many methods too. For example, simple SMAS, extended SMAS, deep plane facelift, high SMAS. There are many methods, but the aim is to not simply lift the skin, but the dear tissue lying beneath. The goal of lifting is not to pull the skin, but how to pull and lift the SMAS tissue is what classical facelift surgeries do. And in order to do the procedure properly, we create incisions. We can approach these targeted areas through an incision, which allows us to pull directly where needed. But what is thread lifting? We go inside the layers to lift from these areas. The aim of thread lifting is not to pull the outer layer skin, but the deeper tissue. Many people are confused and perform the procedure close to the skin layer, which leads to problems such as the threads being too close to the surface, and the effects don't last a long time. So, thread lifting has to change in terms of its goals. It should change to focus on the deeper tissue. The difference is basically whether a person is young or older, but the difference is lessening.
So for our next question, how many threads are there for us to choose from?
Oh, there are way too many types of threads. There are so many types of threads that I can't even remember all of them. However, there are basic shapes. What are they? There are barbed thread types and monofilaments without anything on it. However, most do not use threads without any barbs. So most use barbed threads. Some have barbs on one side, and some have on both, which are used for different purposes. The ones with barbs on both sides help in piling or concentrating, while the ones with barbs on one side helps in settling or setting. These types cover the vast majority of types of threads. So the question is how we use these types of threads to achieve the effects.
Well, how long does the thread lifting last?
We simply use threads only. It does not last that long. Why is that? Why is it that it won't last so long if we only use threads? Let's see if we can hang a piece of cheese on a string and hang it on a ceiling. The cheese will eventually drop off since cheese is very soft and cannot hang on the string. We call this cheese wire effect, as wires can be used to cut cheese. Simply using threads, the lift effect does not last long. Just like we cannot lift something heavy with just threads. We must lower the weight of the area and dissection in order to lower the force needed to pull. So we must think of how to dissect in order to pull effectively. I will talk more later.
So, how long will the recovery period be?
In terms of recovery period, like we see here, before, the day after, and 6 months after. As you can see, she has almost no inflammation. This patient did not just have thread lift, but together with laser liposurgery. Doing laser liposurgery together is a trend these days because it is hard to lift it if the target area is heavy. We remove the fat, for example. Then the effect lasts longer. Also, inflammation is kept to a minimum. If we look here at this person, this is 2 years later. They can redo the procedure every 2 to 3 years. Inflammation subsides fast. Inflammation does not last long.
Would you recommend fat lift or filler for smile lines?
Smile lines, or called otherwise, even kids have them. The issue is how deep are the smile lines, not whether to remove them or not. Long ago, many tried to remove the smile lines. They tried to remove them, but they did not disappear. So they resorted to cutting the tissues altogether through a wire. But after the procedure, patients could not smile. So while it is good that the lines were removed, the facial expression became unnatural. It is very important to look natural. So in order to achieve that natural look, we started to lower the gap difference, which is our goal. So we diminished the area through acusculpting. As you can see, the gap is lessened. So we combine the filling, sculpting as a combination. But with just threading, we cannot achieve this. But if we must do thread lifting, we can combine with open face lifting to reduce a little.
Okay. Well, is it possible to have thread lifts for necklines?
We cannot do much for necklines. The reason is that the neckline is unique in its formation, or shape. The dimples are formed on the muscle itself, similar to a thumbtack board. The neckline is formed with dense muscles, so we cannot do much about it. We can use lasers to lessen wrinkles, but necklines cannot be treated.
So for our next question, what kind of clients should have thread lift?
The best application of the thread lift is for those with drooping jowls. The reason is because when we look at this picture, we see in facelifts, there are retaining ligaments in these muscles, which act as impediments to drooping in the frontal skin, which looks better when pulled upwards. That is the jowl area. We pull upwards like this, vertically to result in this. This is the best application for the technique.
What are the side effects or risk of having thread lifting?
It is best to fully know the surgical anatomy. When the threads are inserted, it is important to know the direction, depth. Also about the nerves and vessels in the area. We must insert the threads without hurting the nerves and vessels. If we indiscriminately insert without avoiding the nerves and vessels, we can have negative consequences such as bleeding or scarring. If there is nerve damage, facial movements can be compromised and result in strange facial expressions. We must be very careful.
What kind of person is not suitable for a thread lift?
Do you think you can change a fat person to look like this simply with thread lifting?
좀 어려울 수도 있죠.
Right. Therefore, like I said before, one must reduce the weight and then pull. If we pull without reducing the weight, we can result in the cheese wire effect. So we must always reduce weight before pulling. If you are not going to reduce weight, there's no need for thread lifting as there will be no effect anyways. We use cowhide leather belts because cowhide leather is strong and they do not break. But if we make a belt with thread, it will break. It is the same concept.
So for our last question, is there any different approach doing the procedure of Asian or Caucasian skin type?
As for skin types, no difference. But it is actually easier to perform the procedures on Caucasians. Caucasians tend to have softer skin as well as the inner layer fats are softer, which makes it easier to move the tissue. But Asians have more firm skin and muscle layers, so it is more difficult. So in that sense, it is a little harder for Asians. So if we look here in this picture, if we can perform like this on this patient, with Caucasians, we can do even better.
그래서 걱정 안 하셔도 돼요.
Yes, you do not need to worry.
Today, the doctor explained in details everything related to thread lift, including its indications and expected outcome. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.